Hi everyone, welcome back to my channel. It's Amin here and I'm filming another genetic counseling video. A while ago, I asked my genetic counseling community on Instagram to send me in some ridiculous assumptions that they've heard people making about the field, and there are lots of assumptions because we are not very well known. So if this is the first time you are hearing about genetic counseling, definitely go out and check out the rest of my videos. But I thought I would have some fun. It's probably going to end up being a ranting video about why our profession is so misconstrued, but I have lots of assumptions that people have heard of, so let's get into it. We can start off with a genetic counseling program, like getting into school. Somebody said that they've heard that it's probably easy to get into a genetic counseling program. So I don't think anybody has specifically told me that they think it's easy to get into school, maybe because I have like so much information online about how difficult it is to get into school. But I've had people that have asked me oh, how can I get in? Like it just comes off like the vibe is that it's easy to get in. You probably know it is not easy to get into genetic counseling school. It is a very competitive field, especially if you're Canadian. We only have 4 certified programs in the country and they each take like less than 10 people. So that's less than 40 spots in the country every year, which is a wild number. So a lot of people do end up going to the US to study, which I did. And so like, that is difficult, like to get into school and then to even get an interview and then be matched with a place. Like there are statistics out there, I think it's like 30-something% of people that apply end up getting accepted to a school, but for some reason it just comes off like it's an easier way to get into school. And yeah, so I feel a little bit offended when people say that because I'm like, no, I worked my butt off to get into grad school and it was very competitive and people have to wait years before they get in a spot. So if you meet a genetic counselor or a genetic counseling student, just know that they worked really hard to get into their program and that it was not easy by any means. Another assumption that I got from some people were that being a genetic counselor is being a psychotherapist or even a counselor of some sorts because it has the word counselor in it. And so this person mentioned that sometimes people start to like dump all of their, trauma or emotions onto them thinking that they could like help them. And although genetic counselors do have training in the counseling side, like it's almost 50-50, I would say, depending on the specialty that you're in. I do a lot of counseling in my work, but I do not actually counsel people on things outside of the reason that they're referred. Like they're referred for, in my case, pregnancy complications or family history, and we talk about these things, but I don't really talk about other things. I am trained, not really from school actually, just from my volunteer experiences, how to handle certain distress situations or crisis situations, but that has nothing to do with what I do on a regular basis. We are not actually therapists, we're not actually counselors. There is that genetic piece of it that becomes in front of it, and that is very important. It completely changes what our career is. And then I got a whole bunch of assumptions in terms of prenatal genetics, which is always like a hot topic. People don't really understand what prenatal genetics is or what we do. A lot of people have different biases in terms of my profession, which I deal with on a day-to-day basis. A lot of patients actually come in with assumptions of what we do. Other providers have assumptions of what we do. So obviously some of my friends have experienced these before. And one of the things that came up was that you should tell people when they should and shouldn't have kids. And like, I've actually had patients that ask me like, oh, so you're telling me I shouldn't have kids? Oh, so you're telling me like, when should we try to conceive? Like, what should I do? Should I go through IVF? I will never tell you what to do. I will give you all of the information, talk you through, the pros and the cons of each different option, each different avenue. But at the end of the day, it is your decision whether or not you want to have children, number one, and when you want them and how you want these children, right? So even for couples that have a risk of having a child with any type of genetic condition, or they're carrying a pregnancy with a genetic condition, I'm never gonna tell you what to do in that pregnancy. I'm never gonna tell you, especially not to have children. Like sometimes people come to that conclusion on their own because of the risks that are involved, but I would never feel comfortable telling somebody that. That's kind of a very personal decision to make. And sometimes people do assume that you were gonna tell me what I should do with my life in terms of my fertility, in terms of my family planning, and that is just not what's gonna happen in our appointment. Very similar to that, someone was told that a genetic counselor will tell you what you should do and push options more than others. And that is something that we actually discuss quite a bit, like even in school. So it was an older school of thought in the field about non-directiveness, where you'd be very neutral in the session. You would not tell the patient what to do. You would kind of just lay out facts in a robotic way and they would decide what they want to do. And I think newer versions of counseling theories are kind of suggesting that you really listen to the patient in terms of what they want. So it really depends on the situation. There are cases where I will tell somebody, I'm going to give you all the options and we'll talk about the pros and cons of them, and it's really up to you because it won't really make a difference. What you choose just depends on what you're more comfortable with. For example, something like a CVS versus an amnio for risk of beta thalassemia in the pregnancy, for example. For those two, it's essentially the same. It doesn't really matter to me which one of those two a person will pick. It just depends on what they feel more comfortable with. And so in those cases, I'm pretty non-directive and I will tell them that. There are situations where I do end up telling people, okay, this is actually, you know, medically preferred, for example. So it's not like I'm neutral in every situation. So let's say we're talking about a condition where the amniocentesis is actually going to be more accurate than the CVS, right? Because of confined placental mosaicism, for example. So in that case, I'm not neutral. I'm not saying CVS is equal to the amnio. You can do whatever you're more comfortable with. I will actually say, you know, medically speaking, this is going to be more accurate for you than the other one. It's not always the case. The majority of the time, I think I don't tell people what to do. And then even if there is something that is better for them medically, I will say at the end of the day, it is your option. You can still tell me you want to move forward with something that we don't recommend and we will arrange it for you. But if it is something that you want my opinion about, I'm gonna give it to you, right? So it all depends on case to case. Kind of similar to that, some people mention that they have been told that people assume that we push others to terminate. So we push patients to terminate depending on the situation. And I actually kind of get this vibe from a lot of people as well, that like I talk about abortion on a regular basis, like it's just a regular word in my terminology. I use it every single day, multiple times a day, and it is my job to coordinate abortions for people. And sometimes people think that I force people to do it, I encourage them to do it, and that is not the case whatsoever. I will give people all of the options, again, in a neutral way, as neutral and factual as possible, and then they make the decision. I've talked about this in one of my vlogs before, especially with genetic conditions. People think that us as counselors, we have a lot of leeway or we have a lot of say in the decision that people make. And more often I find that people have already made a decision by the time they get referred to me, because there is something that has led them to me in the first place, whether that be an ultrasound abnormality their doctor has, you know, already disclosed to them, a high risk prenatal screening result, or there's a risk for a condition that, let's say, both parents are carriers for and they already know what the condition is. There's a 25% chance or 50% chance this condition happening and they're well versed with the condition. Most people will come to me already having an idea, already having discussed between both partners what they would do in what scenario. And so it's very, very rare where somebody is so on the fence about something where I am the one to kind of be like, hey, I would recommend this or I would recommend that. It's actually never happened where I recommend somebody to terminate. If they want to continue, they have all the right in the world and we will support them to continue, right? We will make referrals, we will make delivery plans, we will do whatever it takes to, you know, fulfill their wishes. And that is just so inaccurate. It does like bother me a little bit. It kind of like gives me like a eugenic vibe, which I totally understand. Like our field is rooted in eugenics, right? It's intertwined in a way that it cannot be one without the other. But I personally never, ever, 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 ever tell somebody that they have to stop a pregnancy. I'm very passionate about this topic, as you can probably tell. So let's move on to the next assumption, which is also a prenatal assumption. And that was that we make designer babies. If you are a genetic counselor, how many times have you been told that, oh, do you make designer babies? That word bothers me so much, because what the heck is a designer baby? Like, where are these assumptions coming from? It is not possible with the technology that we have, and ethically speaking currently, you cannot pick the features for your child. If somebody is going through something like IVF, where they have embryos and they decide to have genetic testing on the embryos, it is very specific, at least in North America, very specific on what you can test for your embryos for. And most of the time, it is a genetic condition if you are testing. So there's different kinds of genetic testing on embryos. There is regular testing, which is called aneuploidy PGT, prenatal genetic testing, or aneuploidy PGTA. which screens for common genetic conditions. And then there is a different type of prenatal genetic testing, which is called PGTM, which stands for monogenic single gene disorders, which is what we're able to test for, not even all single gene disorders, but it has to be a very specific genetic condition. When people say, oh, can you pick eye color? Can you pick strength? Can you pick intelligence? There is not a single gene that is responsible for these things. There are so many different genes. We have over 20,000 genes in total, and so there are maybe hundreds of genes working together that will determine somebody's intellect, right? And even with intellect, my opinion is that it's not genetic basis only. Like, there are other factors in life, environmental factors, that will determine someone's intellect. And so when people say that, can you make designer babies? The answer is no. There is no way to pick what's going to happen to your child after they're born. Even physically speaking, there's no way to pick all of these features on a child. And then on top of that, you don't know what your child is going to be like after they're born, right? So there are so many things that can happen in the first couple years of life. There's so many things that can happen later on in childhood, in adolescence, in adulthood. You cannot control your children. You cannot pick which children you get. At this time, there is no such thing as designer babies. There are, of course, whispers here and there of people that are kind of testing the waters and different things that are happening around the world. But in terms of clinically speaking, that is not a thing. We are not there yet. I don't know if we will ever be. I don't know if there's a market for that. I'm sure there's a market for that, but currently that is not a thing. So that is all that we have time for today. If you're a genetic counselor or a genetic counseling student and you've heard of other wild assumptions, please let me know down below. Honestly, I find these things really funny, and I hope you guys enjoyed my ranting in this video. Please make sure to give it a thumbs up if you enjoyed, and I hope you guys subscribe to see more of my videos. Thank you so much for watching, and I will see you next time. Bye.